Acetaminophen, Tylenol, Overdose. Part 1, Background and Pathophysiology. Hi again everybody, and thanks for joining me for another installment of the Pharm Easy Tutor. Today we will begin a 3-part lecture series on acetaminophen or Tylenol overdose. In part 1 of this series, we will go over the background and pathophysiology of acetaminophen overdose. In part 2, we will cover the diagnosis, clinical course, and initial management of the overdose. And in part 3, we will discuss the treatment of the overdose using n-acetylcysteine and fomepizole. So let's begin. Acetaminophen, or Tylenol, is one of the most commonly used oral medications for pain and fever reduction. In the U.S., more than 28 billion doses of acetaminophen-containing medicines are purchased each year. More than 60 million Americans consume acetaminophen on a weekly basis. Acetaminophen is also known as paracetamol outside of the U.S., or by its chemical name, n-acetylparaminophenol, or APAP. In the pediatric community, the use of acetaminophen is very popular because it is readily available as an over-the-counter remedy, and because aspirin cannot be taken by children. Aspirin, which can also be used as an analgesic antipyretic medication, is contraindicated in children due to its association with Reye's syndrome. Acetaminophen has an excellent safety profile when taken at recommended therapeutic doses. However, when acetaminophen is taken in large amounts, it can cause severe liver toxicity. Toxic effects of acetaminophen are characterized by hepatocellular damage, which may lead to acute liver injury, acute liver failure, or even death. Acetaminophen poisoning may occur as a self-harm attempt or the inadvertent consumption of repeated doses in the treatment of pain or fever. Acetaminophen toxicity can be classified into 2 groups. 1. Intentional overdose or suicidal. Acetaminophen overdose is one of the most common poisonings. Or unintentional or accidental toxicity. Unintentional overdose can be divided into 2 types. The first type is misuse, when people underestimate the potential dangers of acetaminophen and have the perception that it is very safe. So they don't follow proper dosing instructions and accidentally take it in large doses because the pain or fever does not diminish after the recommended dose. In some patients' minds, if 2 is good, then 10 is better. The second type is when patients unwittingly take too much, when people do not realize that acetaminophen is contained in hundreds of combination products. This can happen when a person takes too many different medications containing acetaminophen, such as in over-the-counter remedies Theraflu and Excedrin for cold or flu, or prescription narcotics such as Vicodin and Percocet. Acetaminophen is one of the most common medications associated with both intentional and unintentional poisoning and toxicity, according to calls made to the American Association of Poison Control Centers. Acetaminophen ingestions account for more than 100,000 calls into poison centers in the United States per year. In 2022, the American Association of Poison Control Centers National Poison Data System reported 66,710 single exposures to acetaminophen alone. That involved 17,791 in pediatric patients, 32,911 in adults, and 16,008 in patients of unknown age. They also reported they had 13,799 single exposures to acetaminophen in combination with other drugs. Acetaminophen toxicity in the United States is responsible for 56,000 emergency department visits, 2,600 hospitalizations, and 500 deaths per year in the United States. Approximately 50% of the acetaminophen-related cases are suicide attempts. 48% of cases are associated with accidental or unintentional overdoses. Acute ingestion is the most common presentation of acetaminophen poisoning. In the United States, acetaminophen toxicity is the most common cause of acute liver failure. Acetaminophen accounts for 50% of all reported cases. Acetaminophen replaces viral hepatitis as the most common cause of acute liver failure. It is also the second most common cause of liver failure requiring transplantation, approximately 20% of liver transplant cases. Overdose with acetaminophen can occur at any age. It is most common in ages 15 to 24 years. Acetaminophen toxicity is particularly common in children. Accidental poisoning or unintentional ingestion can occur in toddlers and young children when their caregivers give incorrect doses of a medication containing acetaminophen. Overdose with acetaminophen is more severe in those older than 40 years of age. Adults have accounted for most of the serious and fatal cases. Older patients, such as teenagers and adults, may overdose with the intent to do self-harm. In 2023, a panel of 20 experts from clinical toxicology societies and poison control centers in the United States and Canada developed and published a consensus statement on the management of acetaminophen toxicity, entitled The Management of Acetaminophen Poisoning in the United States and Canada. This consensus statement was published in the journal JAMA Network in August of 2023. The primary author is Richard C. Dart. The guidelines were developed through a systematic review of the medical literature, including existing guidelines and 278 publications. These guidelines feature algorithms on how to manage acetaminophen poisoning that can be used by poison control centers and hospitals across the United States and Canada to standardize treatment and improve patient outcomes. These algorithms will be presented in an upcoming segment of this lecture series. Let's go back a few years and go over a timeline of acetaminophen's development. Acetaminophen was first synthesized in 1878, but it wasn't used therapeutically until the 1950s. In 1955, the United States Food and Drug Administration approved acetaminophen. Initially in the United States, acetaminophen was available by prescription only. Once it became commercially available, McNeil Laboratories began marketing it under the brand name Tylenol. In 1961, acetaminophen became available over the counter. In 2011, an intravenous formulation of acetaminophen, Ofirmev, was approved in the United States for inpatient use in adults and children older than 2 years. Let's review the mechanism of action of acetaminophen. Acetaminophen is an analgesic and antipyretic. First, we'll talk about the analgesia mechanism of action. Acetaminophen induces analgesia by inhibiting prostaglandin synthesis in the central nervous system. You can see where the prostaglandins are produced in the diagram. It does this by inhibiting the cyclooxygenase or COX-1,2 pathway, specifically by interfering with the perioxidase POX activity of the COX isoenzymes. This mechanism is different from nonsteroidal anti-inflammatory drugs, NSAIDs. So you can see in the diagram where acetaminophen blocks the perioxidase enzymes in step 2 of prostaglandin synthesis, and where the NSAIDs directly block the COX-1 and COX-2 enzymes upstream. How about the mechanism of antipyresis? Acetaminophen directly acts on the hypothalamus, producing an antipyretic effect. The therapeutic antipyretic mechanism of action is not well understood. However, acetaminophen is thought to inhibit COX receptors in the CNS selectively. Dosage forms. The most common dosage forms of acetaminophen sold in the United States are the 325 mg and 500 mg immediate release tablets and a 650 mg extended release preparation. However, acetaminophen is available in a numerous variety of dosage formulations, including liquid elixirs and suspensions, dissolvable and chewable tablets, caplets, capsules, and paraffin-based rectal suppositories. Common dosage forms and strengths include regular strength 325 mg, extra strength 500 mg, junior tablets 160 mg, chewable tablets 80 mg, liquid 160 mg per teaspoon, suppository in 120, 125, 325, and 650 mg. It's important to note that acetaminophen is available in more than 200 over-the-counter and prescription medications, either as a single agent or in combination with other pharmaceuticals. As we covered earlier, this can lead to dangerous combinations. Acetaminophen is an ingredient contained in many over-the-counter and prescription drug combinations. Acetaminophen is often combined with other active ingredients in many over-the-counter medicines that treat symptoms of the common cold, flu, migraines, allergies, and sleeplessness. In prescription medication, it is often combined with other active ingredients for treatment of moderate to severe pain. Acetaminophen can be found in many products in combination with other preparations, especially with opioids and diphenhydramine. Some examples are presented here. You can see all the different products, including Alka-Seltzer Plus, Anacin, Excedrin, Lortab, Norco, Vicodin, Sinutab, with a host of others. Many people are not aware that acetaminophen is contained in these combination medications. This can be dangerous, as depending on how often they're taken, the total acetaminophen can be too much and can add up fast, resulting in toxicity or overdose. Because other medications have acetaminophen as an added ingredient, people taking maximum Tylenol doses were inadvertently overdosing because they were also taking other medications that contain acetaminophen at the same time. Because acetaminophen is an ingredient that's contained in many over-the-counter and prescription drug combinations, it can be considered high risk. And here are 3 reasons why acetaminophen is a high risk for overdose and liver toxicity. Acetaminophen is readily available over the counter at the drugstore. Acetaminophen is used frequently for pain and fever. And acetaminophen is contained as an ingredient in over-the-counter and prescription combination drug products. Consumers unaware of this danger may be taking too much. Over the years, the FDA intervened with efforts to reduce Tylenol overdose. The FDA introduced several pharmaceutical regulatory changes over the past few years in an attempt to reduce the potential for acetaminophen toxicity in the United States. In 2009, the FDA required that non-prescription and prescription acetaminophen-containing medications provide information regarding the risks of acetaminophen-induced hepatotoxicity. In 2011, the FDA announced an industry-wide transition to one standard concentration of 160 mg per 5 ml for all single-ingredient over-the-counter pediatric liquid acetaminophen products. The move to a single standard concentration was intended to minimize confusion of administration of different acetaminophen preparations by caregivers. In 2014, the FDA advised that combination prescription pain relievers that contain more than 325 mg of acetaminophen per tablet, capsule, or other dosage unit should no longer be prescribed because of a risk of liver damage. And in 2015, the FDA clarified the language of over-the-counter warning labels for adults and children to read that severe liver damage may occur in any of the following circumstances. An adult that takes more than 4,000 milligrams of acetaminophen in 24 hours, a child that takes more than 5 doses of acetaminophen in 24 hours, the product is taken with other drugs containing acetaminophen, and an adult has 3 or more alcoholic drinks every day while using acetaminophen. Unrelated to dosage, in 2013, the FDA advised that acetaminophen can potentially cause dangerous, sometimes fatal, skin reactions. These include 3 rare skin disorders: Stevens-Johnson syndrome, toxic epidermal necrolysis, and acute generalized xanthematous pustulosis. These conditions are extremely painful and can lead to blindness and death. Anyone who develops a skin reaction, such as a rash or blister, while taking acetaminophen should stop using the drug and seek immediate medical care. To stay updated with each installment of the PharmEasy Tutor, make sure to subscribe to this channel. It's easy. Just click on the black subscribe button below to change it to the word subscribed. Then, to get notified whenever a new video comes out, click the down arrow and then select all. Also, if you like videos such as this, please take a moment to click on the thumbs up icon below to change the color to black. Thanks for your help with this. Let's go over the pharmacokinetics of acetaminophen. Ingested acetaminophen is rapidly and completely absorbed from the stomach and small intestine of the GI tract. Peak plasma levels usually occur at 1 to 2 hours post-ingestion, and almost always by 4 hours. Therapeutic levels are 5 to 20 micrograms per mil. After ingestion of an overdose of an immediate release preparation, peak plasma levels occur within 4 hours. Co-ingestion with drugs that delay gastric emptying, such as opioids, anticholinergic agents, or ingestion of an acetaminophen extended release formulation may result in peak serum levels being achieved more than 4 hours post-ingestion. Let's discuss acetaminophen's elimination. Acetaminophen is primarily metabolized by the liver. It is metabolized through 3 different pathways. The first is glucuronidation, about 60%. It is conjugated to non-toxic water-soluble metabolites that are excreted in the urine. The second pathway is through sulfation, about 30%. Non-toxic metabolites are excreted in the urine. Finally, the third pathway is through the cytochrome P450 oxidation pathway. This accounts for 5 to 10% of its metabolism. This pathway produces the metabolite n-acetylp-benzoquinoneamine, or the NAPQI, which, in normal dosing, is conjugated with the antioxidant glutathione and excreted in the urine. A small amount, about 6%, of the drug is excreted unchanged in the urine. Acetaminophen has an elimination half-life of 2 hours. In patients with underlying liver dysfunction, the half-life can be as long as 17 hours. In this diagram of acetaminophen's normal metabolism, you can see that the drug is primarily metabolized by the liver. It is normally metabolized through 3 different pathways. The pathway on top shows glucuronidation, about 60%, where it's conjugated to non-toxic water-soluble metabolites that are excreted in the urine. In the middle, sulfation, about 30%, with non-toxic metabolites excreted into the urine. And at the bottom, cytochrome P450 oxidation pathway, about 5 to 10%. This pathway produces the metabolite NAPQI, or n-acetylp-benzoquinoneamine, which, in normal dosing, is conjugated with the antioxidant glutathione and excreted in the urine. A small amount of the acetaminophen, about 6%, is also excreted in the urine as unchanged drug. One important point to note is that NAPQI is a toxic metabolite, but it is normally rapidly detoxified by conjugation with glutathione into non-toxic metabolites. Glutathione donates sulfhydryl groups that bind to the NAPQI metabolite. However, in acute overdose situations, when acetaminophen is taken at toxic doses, or when the maximum daily dose of acetaminophen is exceeded over a prolonged period of time, normal metabolism of acetaminophen by glucuronide and sulfation conjugation becomes overwhelmed and saturated. This results in a shift in metabolism to the CYP450 pathway, generating more of the NAPQI metabolite. The excessive production of the NAPQI metabolite depletes all of the available glutathione stores in the liver. Once glutathione stores run out, unbound free NAPQI is released to cause havoc. It is very hepatotoxic. NAPQI accumulates and proceeds to destroy liver cells and cause liver injury. NAPQI binds to the cysteinyl sulfhydryl groups of the hepatocellular proteins. This causes oxidative damage and mitochondrial dysfunction, followed by an inflammatory response that ultimately leads to hepatocellular injury and death. Thankfully, there is an antidote to counteract the effects of the NAPQI metabolite, which we will be covering at length in parts 2 and 3 of this lecture series. N-acetylcysteine, NAC, or Mucomyst is the only FDA-approved antidote for acetaminophen toxicity and is the mainstay treatment for significant acute overdose. NAC is a precursor of glutathione. Therefore, as you can see in the diagram, NAC increases the availability of glutathione needed to conjugate with the unbound toxic metabolite NAPQI, rendering it harmless. Some factors that can increase cytochrome P450 activity and can thus increase the risk of hepatotoxicity include concurrent use of anti-epileptic and anti-tuberculosis medications that can increase the activity of cytochrome P450. These include isoniazid, rifampin, phenytoin, phenobarbital, barbiturates, carbamazepine, trimethoprim sulfamethoxazole, and zidovudine. Also, alcoholics and smokers have an increased activity of the P450 enzymes. However, acute intoxication with alcohol or cirrhosis can decrease the activity of cytochrome P450. There are also decreased stores of hepatic glutathione in alcoholics, patients with HIV, and in patients that are malnourished. Glucuronidation is dependent on these carbohydrate stores. Summary. In Part 1, we named the most common cause of acute liver failure in the United States. We compared the characteristics of acetaminophen overdose in the age group 15 to 24 years compared to the age group older than 40 years. We named multiple OTC products that contain acetaminophen combined with other medications. We listed several actions the FDA implemented to curb acetaminophen overdose. We outlined the 3 metabolic pathways of acetaminophen in the liver, and we summarized the steps in which the NAPQI metabolite accumulates to the point of damaging the liver. In Part 2 of this 3-part series on acetaminophen overdose, we will go over the diagnosis, clinical course, and initial management of the overdose. So stay tuned. Thanks for tuning in to watch this installment of the Pharm-Easy Tutor. I hope you learned something that you could use at school or in practice. If you would like to continue to see more of these types of tutorials on YouTube, please make sure to click on the black subscribe button below to change it to the word subscribed. Also, if you like this video, I would appreciate it if you can click on the thumbs up icon below to change the color to black. Also, if you have any comments or questions, please feel free to add them in the comments section below or share the site with someone else. Stay tuned to the Farm Easy Tutor channel for more lectures in the upcoming weeks. So until next time, remember to take it easy.